Hi guys, so tonight we are talking about the top 10 surprising signs of sleep apnea in children. Um, and I just want to bring some things to attention, kind of start a conversation, and let me know what you guys are interested in or what you think about it. I've got the live stream going, so all your questions are welcome, and I'm very grateful for those of you who have already started to join us tonight. So the first thing that I want to talk about is sleepwalking. Sleepwalking may affect about 10% of children at least once between the ages of 3 and 10 and peaks around age 5 and becomes less frequent through adolescence. Sleepwalking may be associated with confusional arousal. I'm going to post the word and definition for that over in the comment section, and that's also where I plan to drop all of my um, resources and research that I did for this event. When it occurs, the child seems to be awakened but remains in a subconscious confused state, most common when waking from slow wave sleep. Although the cause of sleepwalking may not always be apparent, it seems that there may be a consequence of sleep apnea. Sleep apnea can lead to brief awakenings to resume breathing, and this fragmentation of sleep may lead to a state of consciousness that makes sleepwalking more likely. Incidentally, restless leg syndrome and periodic limb movement disorders may also provoke this behavior, which, as research is now showing, both of those conditions are secondary consequences of sleep apnea, because our brain is much smarter than we are, and it says, oh, I'm not getting the oxygen that I need, therefore I want you to kick to wake yourself up, and I want you to move, and if you can't move, now you have to pee. I think that's super cool. Next, we're going to be moving on to clinching and grinding. This is one that I hear all the time. It's kind of a back and forth in the different dental offices that I'm in. Some doctors are like, oh, it's perfectly normal, and others are like, oh, when the molars come in, they'll stabilize. And now a lot of research is showing maybe it's not as normal as we thought it was originally. There is something that's really disturbing about hearing someone clench and grind their teeth. Clenching and grinding may be a way that the body subconsciously remains an open airway and tightens the muscles in the jaw and the tongue. This may prevent a collapse or blockage of the airway, which is often a characteristic of sleep apnea. Our brain is much smarter than we are, so we were going to clench to dilate the blood vessels of the muscles of mastication, which will increase blood flow to the brain. And although night guards are a great barrier to put in place to prevent further damage for adults, we know that we can't put these on kids or we're going to lock them in and they're going to stunt their growth. And now they're saying that we've got to do something, because if we don't treat the airway disorder and those lax muscles back there, then they're going to wear down these teeth. And now we've got an epidemic of adults with sleep apnea in night guards. So it's kind of, we've got to do something. Let's see. Next, I want to talk about bedwetting. I know that this is kind of a taboo thing and might not be something that you see necessarily as part of sleep apnea, but maybe we can help. Children often are going to wet the bed. This is not really considered a problem unless it's twice a week beyond the age of 5. Typically, it affects boys more, and is present between 3 and 30% of children ages 4 to 12 years old. It occurs during slow wave sleep again. During there's a failure to wake the brain when the bladder is full. And it's just one of those things. I mentioned earlier that the body makes you kick because it's like, oh, I don't have it. And then, okay, and now you need to move. I still can't get enough oxygen. Now you have to pee. And that's that cycle that we're going through. Now, I want you to remember there are other things that should be ruled out, like infection, stress, caffeine, other medical conditions. Bedwetting can be a sign of sleep apnea. And fortunately, for those children who are bedwetting due to sleep apnea, treatment will often cause that to go away, which is fabulous. Let's see, do I have my links up here? And paste. So night sweats is the next topic that I want to go through. Unless your child is feverish, it is not normal for a child to sweat violently at night. If the pajama, sheet, blankets are soaked through, this may be evidence that your child is struggling to breathe during sleep. I want you to think about it as being similar to an intense aerobic exercise, and no rest is really obtained. So there's no growth, there's no reset, the body's not able to heal. Sleep apnea is often associated with decreased oxygen levels, spikes in blood pressure and heart rate, and a burst of stress hormone. When this occurs frequently in children, sleep excessive sweating may also occur, and then we find this as evidence as a struggle in the morning. Restless sleep. So it is often somewhat of a joke on how restless a little sleeper can be. Unfortunately, excessive restless sleep in a child can be another sign of a struggle during the night. When breathing becomes difficult, as it does with sleep apnea, this may manifest as excessive movements in sleep. If the covers are twisted into a ball or on the floor in the morning, this could be a sign of distress. Sleep apnea may also manifest as unusual sleep positions. The child may frequently switch sleep positions in an attempt to find an open airway and be able to breathe and sleep simultaneously. I want you to look at the picture that I have up top here, because this was a really cool thing I learned recently. All three of those kids have their head kind of like craned upward, and this is considered a posture a lot like our mandibular advancement devices that we do in dental offices that open that airway. And so that's a huge red flag of, if my kid's sleeping like this, now are they sweating? Are we snoring? Do we have these other things? This is something that you can observe for yourself and say, okay, this is something that I need to look into. Or is this, a one night type of situation that I just need to make sure is not developing into something bigger? Next is going to be snoring. As a rule of thumb, children should never chronically snore. Certainly, an occasional snore may occur in the context of an upper respiratory infection like a cold, but if it occurs otherwise, it is a problem. Chronic snoring is a sign of abnormal flow of air through the upper airway that extends from the nose and mouth to the lungs. The turbulence in those passages that produces the sound, it may occur due to allergies, enlargements of the tonsils, and adenoids, and other problems that can be fixed. Snoring often walks hand in hand with sleep apnea, and if your child snores, it is important to look for other signs and symptoms of sleep apnea. Make sure that I'm getting all of these posted for you guys. Next, I want to talk about growth problems. So everyone with kiddos knows that they love pediatricians visits because you're going to have the measurement of the weight and the height, and they're going to talk about your percentiles, and it's recorded into this graph. And I found a really nice example of kind of what happens here. So this curve shows the percentiles of measurements making comparisons over a larger population for age and sex. For example, a tall and thin child may be 90 percentile for height and 40th percentile for weight. If it is believed that the pre-programmed genetics and um, generally based on is inherited from mom and dad, given proper epigenetic nutrition and general health, these percentiles are maintained stable throughout development. However, if a children falls off the curve, and you'll notice the dots on that upper curve there, they kind of take a little detour. This may lead to maybe a sign of trouble. When we're talking about infants, it's normally associated with feeding. When we're talking about older children, we're normally talking about sleep apnea. So, slow wave sleep is when growth hormone is released. This aids in normal growth and development. When the sleep is disrupted, less growth hormone is released. As a result, children do not reach their full potential and end up being shorter than they otherwise would have been. Fortunately, treatment for sleep apnea can be highly effective in reversing the loss of for the child, and they can often rejoin the prior growth trajectory of the chart. But these things need to be caught and treated early on so that those things can come into play and everything happen like that. So next, let's talk about naps. So everyone's like, oh, I love when my kid naps, right? At some point, it is normal for a child to stop taking naps. If they don't, that could suggest a problem in the quality or quantity of sleep that they're getting at night. At 12 months, many children only nap once or twice a day. That's often in the late morning or early afternoon and should last between 1 to 2 hours. Within 6 months of their 1 year mark, daytime naps may reduce down to just once a day. By the time that a child starts school, naps tend to go away. They don't, or if they don't, or worse, if they creep back into the routine and are become a necessary part, this could be a huge sign for sleep apnea, and is very unusual for an older child to require naps during the day, and excessive daytime sleepiness amongst this group requires further evaluation. And then everyone's favorite topic of ADHD. I've actually got 2 slides to go over here. So attention deficit hyperactivity disorder is a fairly common diagnosis in children, and sleep apnea may be one of the more common contributing causes of the condition. Children with ADHD experience difficulty paying attention, hyperactive behaviors, forgetfulness, poor impulse control, and distractibility. This may affect school performance. And fun fact, children with sleep problems have a paradoxical response. Rather than being sleepy like adults, they often are increased hyperactive. So problems relating to concentration and attention are commonly manifested during disrupted sleep. About 1 in 3 children with ADHD snore compared to only 10% of those without the diagnosis. Therefore, symptoms suggest that ADHD should be a prompt further sleep assessment. And this was just an interesting picture that I found of kind of like the little girls, like all the things and how distracted they are. And I just loved that because there's nothing wrong with her at all. She just needs that attention to express herself. And then I love this little diagram of the brain here and the interconnectivity. And I know that we talked about growth hormone and sleep, and we're talking about a lot with the slow waves. And you might not be familiar with slow wave sleeping, but there's a lot of information out there, and it seems to really play a huge part, especially in our pediatric populations. And then I know I posted a video earlier this week over mouth breathing, but it really is a key part to all of this. So finally, mouth breathing may be a sign of the existence or the risk for developing sleep apnea in children. Humans are obligate nasal breathers, meaning that we are meant to breathe through our nose. If the nose is chronically obstructed due to allergies or a deviated nasal septum, mouth breathing may result. By breathing through the mouth, the muscles of the jaw are in a relaxed position. This leads to elongation of the face. So think Napoleon Dynamite. He's got an open mouth. He's got that long face syndrome. We don't want that. Um, and it can also contribute to weakness of the tongue and other muscles of the oral pharynx. As a result, snoring and sleep apnea may more likely occur in a mouth breather. I wanted to point out one other little detail. Do you see this lovely little girl right here? Adorable, but do you see what they're calling like Venus pooling or allergenic shiners? Basically, she has dark circles under her eyes. That is another big red flag that goes with this. So if we see those little ones walking around, and the young man in the corner over there has it as well, we've got an open mouth posture, a little bit of long face syndrome, those dark circles under the eyes, these are all huge red flags that, hey, we need to be doing something. So my current position here, I am providing services as a myofunctional therapist. I am doing exercises to strengthen the facial muscles, rebalance. So if we have a really tight masseter and a weak buccinator, or we're not utilizing the muscles to chew, swallow, and speak correctly, it causes other problems. If our tongue is not functioning correctly, if we are tethered and we can't do all the ranges of motion that are necessary for breathing and swallowing and speaking, it causes other systemic issues. So I've created oral integration, and currently we're providing complimentary consultations. I do have a 3-page sleep assessment for your kiddos, and even if you're not coming to me for those services, that questionnaire may help guide your conversation with your pediatrician, with a pediatric sleep medicine doctor. Because if you walk in and they start asking you questions that you didn't know that you should have been looking for, then things are kind of out of your hands and they're going to make some assumptions. So take that, print it out. I'll make sure to link it in the comments and just dive into it. See what you see, empower yourself with that information. And then if you would like to do a consultation, I would still like you to fill all of that out before we come in so that we can hit the ground running. Alright guys, it was great to see you. I hope that this information helps, and I'll bring some more research to you next week.